Okay, great. Well, thank you everybody for joining us tonight. Whether you are watching live or you are watching the recording, again, thank you for joining us to learn more about our MSN Nurse Practitioner Program. My name is Tom Kresh. I am the Director of Graduate Admissions, and I will be one of your hosts tonight. I am joined by Dr. Schaefer. Dr. Schaefer, would you mind introducing yourself?
Yes. Hi, everyone. Thanks for joining us. I'm Dr. Schaefer. I'm the interim chairperson of graduate nursing. I'm here at Commonwealth University on the Bloomsburg campus, and I am the coordinator of our nurse practitioner programs. So welcome. I need to plug in my computer. So give me 1 second.
Go ahead. And for everybody who's watching, this event should take between 30 and 40 minutes. It is being recorded, and I'll be sure to push the recording out probably, if not tomorrow, then on Monday. And if anybody has questions, you can feel free to ask them live, or we'll be putting our contact information up at the end of the presentation for anyone watching the recording if you want to follow up. But we can go ahead and kick off the presentation here. Let me just share my screen. A nice picture of Carver Hall in there on the Bloomsburg campus. But the first one, just basically just a softball right down the middle of the plate. Why the MSN in Nurse Practitioner Program, Dr. Schaefer?
Okay. So why the MSN Nurse Practitioner Program? Well, we certainly, there's many reasons why I think that our program certainly stands out. First of all, it's important to note that we are nationally accredited. So we are accredited through CCNE. It's really important that when you are choosing graduate programs, nurse practitioner programs, that you're looking for a program that is accredited. Actually, it's really hard to find, how do I want to say, to be able to even sit for boards if you don't graduate from a program that's accredited. There are programs out there that are not, so you just want to make sure that they are. Most employers also require that. And I think, well, first, and our program is nationally recognized. We have 100% pass rate overall for our board certification. We have about a 92% first-time pass rate for our students. So, if you look at the national averages, that certainly does stand out. That is a well above the national average. It's 100% online. So our program is convenient. We recognize the fact that, when you have nurses that are coming back in to get their nurse practitioner degree, most of them, they're practicing, they have families, they have other things going on rather than just school. And we certainly recognize that. And I think that, if you asked any of our students who have graduated, they would say that we really do try to work closely with students. Life happens, and we know that things come up. But we work around it and we get through it. So, I do think that that's important also when you are going through a program. There's many online nurse practitioner programs out there, but I think there's a difference between a program being online and then also a program being online, but having that close, that good communication with your faculty. And we really do strive to be present and, to be available to our students.
Yeah, I feel like the nursing faculty are very supportive, right? It's like everyone's kind of in this together, and the faculty want the students to succeed. And in order for that to happen, there's got to be some level of accommodations provided. There's got to be some academic support where needed. I think the faculty in our School of Nursing are very good champions for the students and helping them complete the program successfully.
Absolutely. And also a lot of our faculty are graduates of Bloomsburg University, of our program. When we look at Commonwealth University, we have the Mansfield campus, Lock Haven, and Bloomsburg. Currently, our graduate programs are only on the Bloomsburg campus, but we are certainly looking to expand this across all 3 campuses within Commonwealth University. But I think that speaks volumes when you have faculty that they graduate, they go out, they practice, and then, they end up kind of making full circle and coming back and teaching. So we do have a large amount of faculty, even in the undergrad programs. We have a lot of Bloomsburg University graduates. I would say that upon graduation, when our nurse practitioner students graduate, about half of them are already have a job offers. The other half tend to want to wait until they get through boards, they take boards, they pass, before, and that's fine, either way. But, finding a job right now, really, there's so many opportunities that are available. What else do I want to say?
Yeah, it seems like not only is there a nursing shortage, but there's a primary care physician
Yes,
shortage, right? Or primary care
absolutely.
clinician shortage, right? So this is,
Yes.
you're kind of hitting this at the right time, where this is a good investment in your future career, because you're kind of right in the middle of the Venn diagram of nursing, primary care, where that you're going to be in demand.
Right.
It's basically a guarantee.
Right. Oh, absolutely. Yeah, I can't imagine that we would have any graduates that, 6 months down the road, they don't have a position. If they don't have a position, it's because that they haven't, maybe found something that they feel is right for them. But yes, the physician shortage we're really going to see the impact of that. I mean, we're seeing it now,
Yeah.
but over the next 10 years, it's going to be huge. Nurse practitioners, we've proven over and over and over again. There's so many research studies out there that show nurse practitioners provide as good of care, if not better care, as physicians. So that is very well documented. And, we need to take this opportunity and move the profession forward. And I think that we are certainly doing that. Okay. So our programs, so we offer 2 nurse practitioner tracks. We have the adult gerontology, primary care nurse practitioner, and then also the family nurse practitioner, which is now, it's been retitled as the family/individual across the lifespan nurse practitioner. Both of these programs are primary care, and that's important when you're looking for a program, because our students come to us and the majority of them are working inpatient units. Our program is primary care, so we don't prepare students to work in the hospital. That would be an acute care nurse practitioner. So our focus is those outpatient clinics. We have a lot of students, a lot of graduates that go on and they can work in specialty areas such as cardiology, pulmonology, nephrology. They may go and do home visits. So we're starting to see more home-based primary care opportunities out there. And I think that is going to continue to grow. But it's just important to understand what kind of program you are applying for. If you're working in an emergency department and you feel like you want to be a nurse practitioner in an emergency department, you want to continue that, then you would want an acute care nurse practitioner program. So just understanding the difference. And then like I mentioned, our coursework is 100% online. Our core courses, those are asynchronous. So what that means is, we don't meet, there's not a set day or time in which you have to meet every week. You get the schedule, there's a format that we use on our platform. It's usually all of our nurse practitioner faculty tend to do this the same way, where you have week 1, it gives you your assignments, what we're covering, week 2, but you can work through that at your own pace. Just making sure that, you're meeting deadlines for assignments, papers, so forth. But then our clinical courses, those are synchronous. And this is where I think our program stands out from a lot of those other online programs, because we do meet at a certain time each week together. So it's just like you're meeting on campus, you're meeting in class, but we're online. But this way, that's important, because when you are having those clinical experiences, we need to share those with one another. And then you have your faculty there that can answer questions. We can provide more of that didactic information, excuse me, that we feel is important. So there is certainly a level of kind of not one-on-one per se, but you have the value of that in-person instruction. However, you're able to do that online.
And there are a lot of online degrees that are delivered in the format of basically just like online modules that are self-paced that you go through on your own. And it feels like you're on your own, and that's not at all what this program is going to be like. Even though the program is delivered online, there still is that sense of community that's built through the students and through the faculty. And I think that social structure and social fabric becomes really important to people completing the degree.
Absolutely. Absolutely. And we're looking at outcomes. Our goal is we want to take good care of our patients. And we know that you do have to have that sense of community, and you do have to have, you have to be able to reach out, and, that's just something that you don't always get, with just an online program where you don't have that relationship with the faculty. Our curriculum, it's built with working nurses in mind. As I mentioned already, our students, they're working, they have families, one of the requirements for our program is that students have 1 year of experience as a registered nurse. However, we have also brought in, we've admitted students that, maybe they graduated, 6 months ago, but they're continuing to work and they're getting that experience before they would get to the clinical courses. So that's important because you have to develop that good baseline, okay, that nursing knowledge, that basic nursing knowledge. And then through the nurse practitioner program, we build upon that. So you're blending the clinical expertise as a registered nurse, as a bedside registered nurse, with the advanced education, in diagnosing and managing those chronic conditions, and providing that education that our patients need so that they have good outcomes. Let's see. Our primary focus is on preparing primary care clinicians. I did already talk about that. We're not an acute care program. And our program faculty are practicing nurse practitioners. So, I practice, I'm currently practicing in an urgent care setting and on a mobile medical unit, doing, care out in the community. And then our other full-time nurse practitioner faculty member, she also practices full-time. So I think that that's also important because, we're staying up to date on best practices and we're utilizing that evidence-based practice in our own practice, and we can provide that feedback to our students. And, I think learning from others' experiences is important. Okay, so with the adult gerontology concentration, the patient population focus is going to include adolescents. So it's your patient age 14 and above. So those young to middle age adults and older adults. Whoop. There we go.
Sorry about that.
No, that's okay. So options for our program, you can come in as a full-time student, a part-time student, and then we also have the RN to BSN to MSN. So, we have students that, come in they're already a registered nurse and they've graduated from maybe an associate degree program or even a diploma program. They want to go back to get their bachelor's and they want to eventually, get their master's and become a nurse practitioner. So we do have that option available as well. And I will just say, currently we are working on developing a BSN to a DNP nurse practitioner program as well. We're in the very early stages of that, but it's on our radar. It is kind of something that is expected in the near future by our accrediting bodies, that we do have that program available. The full-time program can be completed in 2 years or 5 semesters. And then the part-time program is usually completed within 4 years. And it's variable. And we have students that may come in full-time and then decide that, things happen, life happens, their work schedule, something's going on and they got to work more. They decide to drop back to part-time, or vice versa. They come in at part-time and decide, you know what, I want to speed this up. I want to get through the program. And then they go full-time, and that's fine. And, you know, we have no problem. I think that we're very flexible. And the same with the concentrations or the tracks, where you may have a student that starts off in the adult gerontology track, and then they decide that they want to go into the family track. You know, that's okay too. If you know, once you get started on those clinical courses, you know, you need to have a decision made as to what track you're going to go, because they do vary. But, you know, you have time. You have time to certainly change your mind if that's what you want to do. Our graduates, they do have the capability to practice within the community, those hospital-based primary care clinics, patients' homes, skilled nursing facilities, long-term care, subacute facilities. You know, they're going to private physician offices. We even have nurse practitioners who can graduate and they can go in, they can start their own practice as long as they have a collaborating physician. So there's many opportunities out there, you know, for both concentrations. The coursework for our adult gerontology, like I said, a lot of the core courses are the same for the adult gerontology or the family nurse practitioner. So regardless of the track, you're going to take a theory course. So it's just introducing you to the role of the advanced practice nurse, okay, or the nurse practitioner, epidemiology, research, pathophysiology, pharmacology. So those are your core courses. And then we also have a health assessment course, an advanced health assessment course, which basically takes you through all the systems, you know, teaching you the head to toe assessment, but it goes a little bit beyond. It's more thorough, more advanced than what you do in your undergraduate program. So all of those courses, community assessment and planning is another one. So these are all online. When you get down to diagnosis and management of adult and aged, one. So this would be the first big clinical course. And this is synchronous online. And then, so we have diagnosis and management 1, we have diagnosis and management of the adult 2. And then we have the comprehensive assessment of the older adults. So that is also another clinical course, but those clinicals are a little bit different. Those are set up for you by our faculty. It's only 60 hours and that's a summer course. But that's usually taken between number 1 and number 2 of diagnosis and management. And then for our folks that go on to decide that they want to do the family nurse practitioner track, we have a diagnosis and management of children and pregnant women, because that would be the focus. It is a lifespan, across the lifespan track. And then we have practicum and seminar, which would be the culminating course. And we do have this for both adult gerontology and family. We have that last course where it's kind of bringing the whole program together. Does a little bit of a review, kind of helping you prepare for board certification. We talk about more of the, you know, ethics when it comes to advanced practice nursing. We talk about the business end of it, you know, some other topics outside of just that diagnosis and management and caring for the patient. So the family track. So again, this track focuses on children, adolescents, adults. So it's across the lifespan, okay, from birth to death. You have the full-time option, the part-time option, and again, the RN to BSN to MSN is available. And I would like to just point out, with our RN to BSN to MSN, there is a hard stop at the BSN. So the students would graduate with their bachelor's degree. So they would graduate with their bachelor's degree and then they would jump right back into their master's. And when they graduate with a bachelor's degree, they've actually already taken 3 courses towards the master's. So they have 9 credits, you know, that are actually master's level courses, you know, which is nice because it kind of gives you a little bit of a jump to get into that master's program. Again, the full-time program, this is completed in about 2.5 years. There is an extra semester with the family concentration because of that pediatric and care of pregnant women. So that does tackle on an extra semester. There is a strong emphasis on meeting the needs of the community, the underserved populations, those high-risk population, and multicultural populations. And that's really where nurse practitioners thrive, is those underserved populations. You know, we're the ones that are, you know, hey, we're willing to get out there and care for patients in these underserved populations. You know, maybe they're underinsured, you know, rural areas, and so forth. And graduates of the program, they can provide primary care in a variety of primary care settings, which I mentioned before. Again, you know, it's those clinics, you can go into specialty care. So the opportunities are numerous. Again, for our coursework, so the core courses are the same, and I did already cover the clinical courses. You have your diagnosis and management 1 and 2, and then you have, oh, we just have them switched. We have adult gerontology primary care practicum on this one. It would actually be the family practicum. So they're similar. It just tacks on an extra semester for that pediatric course. You can go ahead and, okay. So looking at the job outlook. So average salary for nurse practitioners, on average, you're looking at around 120,000. Again, it's going to depend on your setting. So if you're in a primary care clinic, you know, if you're doing family medicine, you know, the salary may be a little bit different than if you're in a specialty area. But on average, you know, this is what our salaries are looking like. And these have really come a long way, even in the past 14 years that I've been practicing as a nurse practitioner. When I graduated, I was like, oh my gosh, you know, I could have done one day overtime and and made what I started off. So we're really starting to see the value of nurse practitioners, and you know, we're seeing that in the salaries as well.
That, and if you look at just the demand. So
Yes.
normally a strong, you know, growth projection is 5%, 7%, 45%. That is astronomical. That is enormous. So, you know, we talked earlier about the demand for nurse practitioners and primary care clinicians. 45%. That is huge.
Right. Right. So, you know, okay, we can go ahead and, okay, so application and admission process. So our requirements for applying to our program is, of course, you need to fill out an online application. There is a fee for the application. I don't know, Tom, if you have any additional information on that.
For attending this virtual event, should you choose to apply, we will certainly waive it. Just email me, and again, my contact information I think is on, if not this slide, it's on the next slide. And just email me once you've applied, and I can waive your application fee. Same would go to anyone who watches the recording.
Okay, wonderful. Official transcripts from all post-secondary schools that have been attended. So it's important that we do have all of your transcripts, and you can usually request those on the website from the school that you had attended. You can request transcripts and they can be sent directly to us. A copy of your current Pennsylvania nursing license, and a resume, which includes a description of professional nursing and clinical experience, and your career goals. So we certainly want to make sure that, you know, we are helping you to meet your career goals. And we do, there is an interview process that we have our students that apply. We do set up interviews because we want to make sure that our program is right for you and that we can meet those career goals. Right. There is a requirement for 3 recommendations. So these would need to be professional recommendations. And then, as I mentioned before, 1 year of a current acute care experience. So, you know, hospital-based experience, or when we say acute care experience, the majority of our nurses come in, they're working in the hospital. However, you know, if you're working in a physician's office and you've been working in an outpatient clinic since graduation from nursing school, you know, that's fine too. So.
Yeah. And then this is the cost. I know among the, most common questions we get is, how much is this going to, cost? And I'm not sure, if we have a group of in-state or out-of-state people who are watching the video, but you can see the cost, per course and the cost per 6 credits. Dr. Schaefer, generally, how many credits are students taking per semester?
So per semester, if they're part-time, it's usually taking 6 credits, between 3 and 6 credits, which would be 1 or 2 classes. When you get to the clinical courses, they are 6 credit courses. And then full-time is considered 9 credits for graduate load.
Yep. So basically, you would just want to take that initial number there, if you're an in-state student, of the 3 credit course, and multiply that times 3. So that's probably around 5,400 ballpark estimate, per semester. And I think that's one of the biggest benefits that you'll see by coming to, Commonwealth U Bloomsburg, is that the value. You're going to pay a lot less coming here than what you would going to another, to a private college or a state-related institution. So you'll get better value here than you would somewhere else, which means that less debt to pay back, right? Less of a debt burden, and more of your hard-earned income will be yours, and not having to pay that back. So this is about as good of an investment in your future career as you could probably make. But we always try to make sure we include a slide in here about the cost. And then that gets us to our contact information. And I would encourage you to call us, email us. You can stop in to see us if you want. We work for you. We work for you, and we're certainly happy to do so. So that kind of ends the presentation part. Are there any questions from anyone in the group? And if not, that's fine. That's fine. And for anyone who's watching the recording, you can feel free to follow up with Dr. Schaefer or I via email or phone. We're happy to help. Questions here? Yes. Yes, go ahead, Catherine.
Yes. So the clinicals that we meet once a week is it at a particular time on the same day of the week? And for how long is it? Like, is it a 6-hour thing or?
Okay. So the courses, so the didactic portion of the course. So we would meet 1 day a week. It would always be the same day. The class time is usually 3 hours. So our classes usually run around like 5 to 8. Sometimes we'll go from 4:30 to 7:30 if the group, if that can be accommodated by everybody. But yes, they're always on the same time. So, you certainly have a schedule. And then when you're actually doing your clinicals, so when you're out and you have a preceptor and you're completing your clinical hours, which that's one thing, Tom, I did not talk about, is I will mention that quickly. When you're doing your clinical hours, that's usually 2 days a week. Usually like two 8 to 10 hour days per week, whatever you organize with your preceptor.
Okay.
Yeah. So for our adult gerontology NP program, our total clinical hours are currently 720. However, the accrediting body, which is NOMF, they have increased that to 750. So we are going to be making that change in our curriculum very soon. So we're going to be bumping those hours up to 750. However, our family nurse practitioner program, those students, they get 920 clinical hours. So we are well above, what's required. But I think that that's certainly an advantage, because if this is going to be your career path that you choose, getting as most clinical experience as you can now certainly is going to prepare you better for after graduation and practicing. So
Okay, thank you.
Absolutely.
Yeah, that's a great question. That's a great question. Anybody else? Dr. Schaefer, you teach a lot of classes.
I do.
Taught many classes over your career. What's your
Yes.
favorite class to teach?
I would say my favorite class to teach is probably the pediatric course. My favorite population to work with is adolescents. So yeah. Now that may change now that I have a 13-year-old.
Right. Yeah. Yeah.
But yeah, so I would say the pediatrics, and then also currently I'm also teaching the seminar course, which is the final course before the nurse practitioner students graduate. It's like I said, it's kind of it's a review of like the whole program, you know, and preparing you and looking at those professional issues and things to kind of expect, and maybe things that aren't clinical based that you need to, that are going to be important in your practice, the business end of it, you know, coding and, you know, payment and billing and all that stuff that, you know, all that boring stuff that we don't really like to focus on, but we have to, because we all have to get a paycheck. But so I would say that those are probably my favorite courses.
Okay. All right. Interesting. And
Yeah.
can you speak about the, and Catherine, if you have another question, that's fine. I can't tell if that's just your hand up from your previous question here. Okay. Can you talk about the work-life balance? I know because a lot of your students are probably working
Yes.
while completing the degree. Can you talk about what their week might look like? And I know that, you know, the standard answer is no two are the same, but if you had to give a general expectation of what the life of a student in your program might look like.
So almost all of our students are working. We do recommend, and it is just a recommendation. Now, I know like with the nurse anesthesia program, you know, after they get to a certain point in the program, you know, they really can't because they're doing so many clinical hours and they're on site and so forth. But we recommend that students try not to maintain, you know, full-time hours once they get to the clinical courses, because you do have to look at, now you're going to have 2 days of clinical that you have to complete, because you have to get through that 200 hours a semester, 210 hours a semester. So you have to figure that in. And we certainly, we know the importance of work-life balance, because, you know, we all have families and, you know, we work and we practice and we do all these things too. So if you, I would encourage folks that are really thinking about applying to the program to maybe talk to their supervisors and just see what level of flexibility they could have in their schedule in case things get a little too tight. Maybe they're finding that they're getting a little overwhelmed with the clinical hours and trying, you know, to raise their family and do, you know, whatever else it is they do that's important. You know, you want to know that you have that flexibility and you have that support from your employer. Otherwise, it can certainly be more challenging. But again, like I said, we realize that things happen, and if things come up, you know, we're more than willing to work with students, you know, on if whatever it is that, you know, that we can do to provide the support and the help that they would need, because we want you to be successful. We want everybody to be successful in our program.
Great, thank you. Any other questions from the group? And if not, that's okay. You know, I know you've got our contact information. So as everyone is kind of wrapping up the, you know, thinking about asking questions, Dr. Schaefer, do you have any parting advice for the group here before we sign off?
I would say, you know, if you're thinking about doing this, and obviously you are, right, because you're attending. it's a thought anyway, even if it's remotely in the back of your mind. You know, I hope that you do apply. I'll tell you, I've been a nurse for, you know, almost 30 years now, and I can't think of another profession that I could possibly love as much as I do nursing. And we all have good days and we all have bad days, but still, you know, and I think as a nurse practitioner, stepping up to that level where I am, you know, I'm managing care for patients, and I'm, you know, it's great to build those relationships with your patients. It's been a very satisfying career for me. And, you know, I hope that you take that step. And, you know, don't be scared, because we are here to support you and we want you to be successful. So we'd love for you to come join us.
Excellent. Well, that kind of wraps up the event for tonight. Thank you, everybody, for joining us, who's watching live, or anyone who's watching the recording. We certainly look forward to hearing from everybody in the future. Like I mentioned earlier, Dr. Schaefer and I, we work for you and we're happy to do so. So we hope to hear from you, and have a wonderful night. Thank you, everybody.
Thank you. Bye-bye.